what are the common mistakes that most people make when trying to use movement for pain relief?
Intensity is probably the biggest mistake. The body that has the problem, people will just add challenge to it. So I want you to think about, if there's pain, there's an issue. Something's not working the way it should, or it's designed to do here. So if that's your baseline, most people will just immediately look for exercises, strength, stretching, mobility, like let's go activate the nervous system to go make a change. And because the worse people feel, so the higher that pain signal is, the more intense of a thing they're looking for, because they equate intensity to efficacy. One of the primary principles that I use to help people in pain is we first have to relax the problem. If you've got a hip imbalance, if you've got asymmetrical pain, one side of your body is in more pain than the other side, chances are the body's out of balance. So if I just go give you PT and traditional rehab work, you are going to do that work, even if the exercise is quote unquote good, you're doing that work with that problem. Remember, the problem is with the neuromuscular system. Nerves and muscles are no longer communicating well together. So we're going to add more stress to that. Most people are going to find no wonder why exercise hurts. No wonder why it takes them forever to recover. No wonder why they loathe movement, because they've learned the more they move, the worse they feel. More movement does not equal better movement. Better movement equals better movement. So step one in resolving this issue is we have to work with the neuromuscular system as it is and tame that problem. We have to calm it down. And you can do that with basic, simple, gentle movements that just get some parts of the body moving again. And then we slowly rebuild intensity from there. Most people just want to get straight to the complicated, the tricky, the high level stuff when they can't even control their body in a basic way. So step one is let's get the basics of movement before we even bridge into the more dynamic stuff. And that is corrective exercise 101. In almost any corrective exercise protocol or curriculum, step one is dealing with the nervous system. Well, most people just want to get moving. And that's one of the biggest challenges or the biggest mistakes that people make.
It's just like with diet, where if you're in a stress state in your body, life is stressful, and you try to intermittent fast or you try to run a marathon, it's going to backfire, right?
Yeah.
Because your body, your nervous system can only take so much. It will go into survival mode to protect you.